Welcome back. Well, most people have heard of menopause, but before that, it's a different stage of a woman's life called perimenopause, and the experience could really throw you for a loop.
Yeah, perimenopause is the change actually before the change, and while most people focus on menopause, this transitional period is where you could actually experience the most symptoms.
Yeah, joining us now to talk more about it is Elektra Health co-founder and COO, Janine Versi. And Janine, thanks so much for being here with us this afternoon.
Thanks so much, Tamsin and Arnie. It's wonderful to join you.
So let's talk about it. Let's define what is perimenopause and what age approximately does it start?
Great question. So just for those who don't know, Elektra Health is a female-founded women's health company focusing on helping women navigate this entire journey, starting with perimenopause, indeed the change before the change, with expert education, care, and community, and we are New York founded. So perimenopause tends to set in the early to mid-40s. It can be later and it can be earlier, but it is really a natural biological process caused when our ovaries stop functioning gradually. Ovulation becomes erratic and then stops, and the menstrual cycle starts to change, often becoming irregular. And we like to say that this kind of formally kicks off a person's menopause journey.
Okay, so Janine, walk us through what are some of the symptoms of perimenopause, or what should people be looking out for?
So there are a number of symptoms, and they can really change over the course of this journey. But the ones we hear about the most frequently from our members at Elektra start with erratic, irregular periods, often really heavy periods that seem totally out of the blue compared to what your cycle might have been like. Definitely difficulty sleeping, hot flashes, and the nocturnal counterpart of night sweats. Vaginal dryness or pain during sex and urinary urgency are also pretty common.
I feel like I can add 30 more symptoms to that list, Janine. You know, I can.
I know. I wish that weren't the case.
We didn't have enough room.
The good news is
we didn't have enough room on the graphic.
Right.
Let me ask you something. How can you tell? Because this is something that a lot of us have already lived through. Some are going or living through right now, or are going to. How do you know whether or not it is perimenopause or something else?
Great question. Top 5 question that we get. And this is where having access to science-based information and experts who've actually had some training in menopause can be helpful, because perimenopause can mimic other types of health conditions, for example, a thyroid issue. But if you are experiencing a change of about 7 days or more in the length of your menstrual cycle, you might be in early perimenopause. Whereas if you're experiencing more like 60 days or longer in between periods, you're more likely to be in late perimenopause on that side of the transition. Hot flashes are super common, as well as these other symptoms. So if you're experiencing a constellation of those issues, really good to check in with a medical expert who has some training in this area.
So how long does this typically last for someone?
Often 5 to 7 years, and that's leading up to 1 full year, a consecutive year without a period, which is menopause itself, really one moment in time. Perimenopause is prior, and then post-menopause is where women spend the rest of their lives, sometimes up to half of their lives.
Yeah. Well, is there anything, let's talk about this. Let's talk about relieving symptoms. That's a question that, is probably another big top question, because people say, like, I have all these different symptoms, so what can I do to relieve them at the perimenopause stage?
Yep, absolutely. And, what I was saying in response to the long list of symptoms, which is unfortunate, and we wouldn't wish that upon anyone, is that there really are safe and effective medications and solutions out there. Many people talk about wanting to have natural tools at their disposal that can include lifestyle changes as well as some supplements. But what I would emphasize is that if your symptoms are disrupting your quality of life, you may benefit from hormone therapy, which has a bad reputation, but it's oftentimes really safe and effective and comes in pills, patches, creams, gels. So you could talk to a provider about that, as well as for other potential supplements. You want to make sure that they have been tested, that they're legitimate, and you want to avoid contraindications with other medications, as always. So again, great to connect with a provider that's trained in the space for that conversation.
All right, you touched on this a little bit just moments ago, but how can you really tell, and what should people do if they're going from perimenopause to actually menopause?
Yeah, so tracking becomes really important, because, we identify this as 12 months without a period. So it's helpful if you are actually really paying attention and able to track how many months it's been. We do oftentimes speak to women who are like, I've made it 8 months and I just got my period, and the clock restarts. But yes, unfortunately it does. But 12 months without a period and you're safely in menopause, you're unlikely to be ovulating. But there are always, questions and inconsistencies, and a lot of women are going through this. We like to say at Elektra, we're here to smash the menopause taboo. We can normalize this conversation, get women the help that they need and deserve so they can live well and thrive through it.
Wonderful. All right, Jean, thank you so much for being here with us today. I know you guys do a lot of great work and look forward to having you back.
Thank you so much. Appreciate it.